So essentially, like I said, we're going to be covering exactly how you should go about launching a healthcare staffing agency or a medical staffing firm or a nursing agency. Now, keep in mind that these principles will apply to any industry group in healthcare and even outside of healthcare. Wherever there's an arbitrage that can occur between a supplier of staff and a organization that needs staff, there's a potential to add a markup, especially if that position is in high demand or hard to land. So to get started, let's talk about why would somebody want to get into this industry. First of all, the healthcare industry in the United States is a $4 trillion a year industry, which means that $1 in 5 that's transferring hands in the United States is due to a healthcare transaction. That could be pharmaceutical sales, that could be procedural, that could be PCP visits, medical devices and sales. The entire industry at large, $1 in 5 that are exchanging hands in the US are exchanging hands because of some sort of healthcare service. I have this general philosophy that as a business, you should focus primarily on human needs that are actually vital to survival or adding significant convenience and value to humans' lives. Now, the 5 industry groups that I always recommend that are vital are healthcare, housing and shelter or real estate, farming or animal products, vegetables, etc., food and sustenance, energy, that could be renewable energies or it could be combustible fuels, and lastly, transportation. These are all things that humans are using on a daily basis and multiple times per day in the occasion of food. And if you're investing in one of these 5 areas, you have a high probability of generating revenue for sure, because these are going to be the needs of the people in your community, and a high probability of finding success and a tranche of business for you. Another thing that I believe is that when the market size is large, like a $4 trillion market, it's kind of hard to not enter the market and essentially catch some of the cash that's kind of floating around. I don't want to make it sound corny where you're like in a cash chamber, but it really is similar to that because there's just so much business being done within the space that if you kind of set your stake, there should be the potential for you to do business. As it stands now, the need for healthcare professionals still exists and continues to grow as the American population ages. And it's important to note that the higher the skill set, the higher the demand tends to be. So as we get more and more advanced and there's a greater focus on more and more education, the need for highly educated healthcare professionals is also increasing. And I like to think that now is a good time to get into the industry, not only because of this high demand, but because the demand is growing. Over the next 7 years, we're expected to see significant growth in healthcare, mainly due to the aging population of the United States. So just to go over some industry basics, a healthcare staffing agency or a medical staffing firm is a middleman that is providing essential staff to healthcare facilities and providers. This can be on an outpatient basis, such as in pharmacies, uh, assisted living facilities, home care agencies, any doctor's office that's in the community, or on an inpatient basis, like in skilled nursing facilities or hospitals, and everything in between. Okay. The industry has been steadily growing and has been in a shortage for the entire time that I've been in the business. Now, I've been in this business since 1996, starting off as an assistant to my mother, who was a nurse who decided to start out one of these nursing agencies because she saw an invoice and thought it would be a great idea to whip up her own agency and be able to benefit from What she saw was an opportunity to staff nursing facilities. Okay, so for as long from since 1996 to present, there has been high demand. The only time that I've seen extraordinary demand that I've never seen before, the only anomaly in all of those years was the COVID epidemic or pandemic. And that was really uh, a one in a lifetime sort of event. I don't think we're going to see those same levels ever again. But what has been consistent, aside from that COVID bubble, has been that healthcare professionals, especially nurses, have been in need for the entire duration that we've been in business, giving us an opportunity to generate revenue from that matching of professionals with facilities. As I mentioned before, the US healthcare industry for healthcare staffing in itself is $41 billion and expected to grow at a rate of 6% a year through 2030. So over the next 7 years or 6 years now, we're looking at close to a 40% overall increase in the demand and growth within that sector. So if you were to start today, you stand to benefit from that increasing need and increasing demand to nearly 40% over the next 6 years, which is great for a great environment to launch a business. You don't want to launch a business, for example, into paper media like newspapers, right? That's an industry that's on the decline. You would like to see healthy growth like 6%, 10%, or higher growth year over year for a particular industry. It lets you know that there's legs and there's an opportunity for you to grow with that industry. And as mentioned before, the largest or one of the largest demographics in the United States, the baby boomers, are all going to be in their golden years. And because of that, they require more healthcare services, both in the community and on an inpatient basis. So all these factors combined creates a unique opportunity for you to take advantage of today. Now, I don't like to present this industry as a all perfect, all good industry. It's going to take significant work to be successful. Because there's such a great shortage, a lot of people tend to think that because there is such a high need, it's going to be easy for me to go out there and hang my sign and hang my stake. It's not that way. One of the major challenges is that it's going to be a competitive industry, mainly because there are limited resources. The reason why you can make money in medical staffing is because there aren't enough healthcare professionals, and you're able to charge a premium by recruiting and placing them. So you and every other staffing agency and every other healthcare facility and provider are recruiting from the same finite pool of resources. Because the immigration policies in the United States are not that loose when it comes to recruiting international professionals, we can't even make up for the lack of staff through international recruiting. So we're really just fishing from the same pond for the resources. So whoever is better at capturing attention and converting that attention into workers and retaining them win in this game. Healthcare is quite complex, and you need to know how to navigate the regulations. Some of the states are licensed, and securing and maintaining a license requires you to follow quite a few compliance standards. So it's not as simple as, okay, one morning I'm going to wake up and launch my agency. There are steps that you're going to have to take, such as securing a license with your state, getting your insurance compliant, putting together your policy and procedures, your employee manuals, and everything that you need to actually operate the business. So that is also a heavy lift. Attracting and retaining talent. Since it's such a competitive landscape, you have to stand out when it's time to attract talent, and you have to do good by your team in order to retain them. That is providing a good work environment, great customer service, wages, the opportunity for your staff to give you feedback. All of these things are meaningful to the worker. And the better you are, again, at attracting and retaining your staff, the likelihood of your growth following that is going to be higher. Okay. But at the same time, you are competing against an entire industry for the same limited resources. And another thing that makes it challenging is that healthcare is rapidly changing. Some of you who are healthcare professionals have seen the introduction of EMR systems, how that affects some of the older healthcare professionals that aren't as quick and able to adapt to the new technology. This also reduces the amount of people who are able to keep up with the changes and able to stay active in the workforce, because technology is moving so quick and because things are moving a lot faster. Not everybody's able to keep up. However, these same challenges are why opportunities exist. Because of the shortages and the difficulty with technology and the aging of our population, there's strong demand for professionals. There are opportunities in very niche tranches. Everybody thinks nursing, ICU, med-surg coverage, when there is a significant need for radiation dosimetrists to do cancer treatment planning. A lot of people don't think about that as an option, but that is something that exists. It's something that you could staff for, not only on a facility level, but on a per plan basis. Specializing in niche areas can obviously open you up to new opportunities. If you are someone who decided to specialize in staffing radiation dosimetrist, that may open you up to other cancer treatment professionals like radiation therapist, or even get you into a pharmaceutical niche, because you are addressing a specific disease process, a specific treatment style that may lend to a broader audience. So because there are so many micro niches within healthcare, you're able to carve out your slice and build your brand and reputation around one specific thing that may be getting ignored by all the other agencies and professionals. You also have the opportunity to collaborate with healthcare facilities and institutions that can provide a steady source of contracts and a steady source of business. So the business is going to come in two forms: either on a contractual basis, where you might be staffing with facilities on the West Coast, Washington, Oregon, and California. And you may have 50 facilities that you're able to contract with on a term basis, as well as short-term coverage. So you working with facilities directly opens the doors for so many placement opportunities, especially if you're going to broaden yourself and staff other professionals outside of nurses. So to talk a little bit about the steps on how to start one of these businesses, the very first thing that you have to cover is the actual legal compliance. This is setting up the entity, securing your licenses, getting the necessary certifications to operate within your state or within the region that you are choosing to operate in. You're also going to have to adhere to whatever the compliance standards are for that state. Not every state is licensed, but most states are. And those that historically haven't been licensed, like New York, where we operate, have also turned a corner and started to mandate licensing. So this is just one more layer of compliance, another fee that has to be paid, and another government body kind of breathing down your neck. But this is the first step that you're going to have to undertake, is really understanding the licensing landscape and compliance landscape of the regions that you plan on staffing in. I always recommend you start off in the environment that you know best, which tends to be your home state, prior to branching out. That's just my suggestion and rule of thumb. But every state has slightly different rules. They have slightly different licensing criteria for different professionals, especially nurses, which are typically licensed on a state-by-state basis. So you have to learn those nuances in the regulations, in the licensing, in the background checks that are required for the state that you're going to be operating in. Once you have it down that, what you need to do to be compliant, what sort of entity that you have to create, and how you have to be structured, the very next thing that you're going to have to kind of plan and think about is the infrastructure and technology that you're going to use to run and operate your business. You're going to have your basic documentation, like your job applications, your checklist for making sure that all the employees that you're hiring are in compliance with state regulations. You're going to have you're going to need policy and procedures. You're going to need timesheets or a digital version of a time and attendance tool. You're going to need even physical forms so that your employees who are coming to work for you, who need to maintain their physical health, they may need forms to bring to their doctor to be filled out to prove that they are fit and ready and able to work. All of these documents you need to put together. And obviously, since you're dealing with employee records, time and attendance, you're dealing with your contracts, you're dealing with scheduling, you're going to need some sort of tool that allows you to manage all these sides of the business, while you're going to need those tools to, sorry, I'm just letting more people in. You're going to need tools that allow you to manage all sides of the business and keep yourself organized. Because when you're just staffing 3 professionals, yeah, you can handle it by yourself, and you'll remember whose physicals are due and expired because you're touching every file. But once you get to 20, 30, 50 employees placed, it becomes quite a task to keep track of all of that information. So a suitable and reliable software is absolutely something that you're going to need. We've developed our own software that we now license out to other medical staffing agencies, home care agencies, adult daycares, and we're looking to actually add homeless shelters and adult living facilities to our charter as well. If you are interested in software, we'll talk a little bit about that in detail at the end, but the software name is OnTime ITS. It handles all those things that I just described. You could kind of check out a demo on that and see if it's going to be the right fit for you. And before launching, you have to build the appropriate team that's going to help you manage the business. When we started in the family business, the team was mom, me, and my aunt that would help out from time to time with the administrative task. Then it was my brother's girlfriend that also joined and started helping out. And we were a motley crew of people just trying to figure everything out on our own. The internet was a completely different tool at the time. You couldn't find this level of information. It just did not exist. So we were just doing what we could to figure out these things on our own. Trial and error was how we did everything. But building out that initial team is going to allow you to kind of segment out who's responsible for what. You might want to have somebody in human resources that's completely dedicated to recruitment, onboarding the staff, reviewing and maintaining their employee record compliance. You may have one person in business development that is completely focused on going out there, landing contracts, negotiating with providers, negotiating with physicians to ensure that you're finding the right staff that they're looking for. And you also should have somebody that is more finance focused on that initial team that can manage billing, payroll, and your bookkeeping and just the day-to-day. If you can afford to have 3 people or it's 3 founders coming together with those respective skill sets, fantastic. If you can't, you're going to have to either outsource some of those roles or become a jack of all trades in the beginning until you have enough cash flow to start hiring out. Now, once you've got your legal compliance set, you've set the infrastructure, you got your team in place, you got your software in place, you have all the documentation that you need to go out there, contract, job applications, everything that you need to actually run the day-to-day, it's really time to go out there and build your business by properly branding yourself and getting yourself in front of your target customers. Now, remember, you have 2 target customers. You have the employee that you need to attract and retain, and you're actually generating income off of the employees that you bring in place. and then you have all the facilities that you're trying to contract with as well. So you need to get in front of both of those customers. And obviously, you need to make sure that your branding appeals to healthcare professionals and to institutions, and that they're able to find you, whether it's through online searches, uh, posting your ads in on job boards, etc. You're going to have to make yourself visible, and it is going to need to be clear to people that you are a provider of X staff, so that it all registers when they have that first interaction with your company. So just to talk through how we could help, there's a lot of different ways that we help our people who are looking to get into this industry. One of the ways that we help is that we help agencies get completely set up. Okay. Now, what we mean is we work with individuals or founders looking for guidance for one-on-one assistance. And we do this through coaching them and assisting them with starting their own healthcare staffing agency. Okay. We do everything that is required to get you launched. And by everything, it is training, setting up your software, getting you trained on that software, providing you with one-on-one consulting. We give you advice throughout the entire project. We work on your branding materials, your website, your marketing media, your recruitment plans, your go-to-market strategies, everything that is required for you to really hit the ground running. In fact, we take care of all of the compliance and licensing so that you could focus on what matters the most. And what we find, or what we found with a lot of people that we consult for, is that they go through the checklist of organizing the business without ever speaking to a customer. And that's probably the biggest mistake that most founders make. So what we do is we take that away, right? We take away forming the business, which leaves you with the core responsibility of going out there and landing your business. A lot of people who thrive in medical staffing are connectors. They're able to present themselves, get in front of an audience, and sell themselves. And a lot of people who don't succeed are very responsible healthcare professionals who know how to follow protocol and procedure. So they're comfortable doing all of the administrative setup, but once it's time for them to get in front of the customer, they get spooked and they revert back to retweaking their website, readjusting their paperwork, and never talking to the customer. So the way that we organize our assistants is that we, while motivated, we put the founders in a position where their assignment is to immediately start connecting and not allowing themselves to get stuck in this cycle of perfecting the appearance of the business, because that is not what actually gets the deals closed. It's actually meeting with people, developing relationships, that is going to take you really to the next level. We also provide self-directed courses, which are online courses that allow you to kind of complete the setup independently. So the same way that we help founders get set up, where we do everything, we have a self-directed method where we give you the guidance. You have a course that you can kind of take at your own pace. And that course is designed that if you follow it from lesson one, that you're going to be setting up your business appropriately. A cool thing that we do is that we provide additional documentation, like a sample contract, rate calculation spreadsheets. We provide you with a framework for your policy and procedures and employee manual. We give you the tools that you need so that you're not spending a bunch of time necessarily kind of doing what we did when we got started, which was a bunch of Frankenstein documents, right? We took documents from anybody that we could and kind of merged them, retyped them. It was a heavy lift. What we've done is we've kind of condensed that and made it a lot simpler. We also have a group mentoring component to our self-directed courses, meaning every month, the team of founders, anybody who has purchased into this, as well as the turnkey or the full service setup, you're invited to join us in our monthly calls where we answer questions and go over kind of new industry news and any changes and any recommendations that we have ongoing. And that is for life. So whether you're a full service client or you're going to self-directed route, you have access to join our group mentoring sessions for the rest of the time that we exist as a business. So as long as we're operational and we're running our group mentoring sessions, you're more than welcome to join us, get your questions answered. There are going to be people of different levels there. They're going to be the fresh founders, and there are going to be people who've been operational for 2, 3, 4 years coming back, presenting their new scenarios. This happens currently where we have clients that have gone through our programs, set up their businesses, they're landing a new contract type that they've never had before, and they come back to ask their questions in those calls so that they get that continued support as they grow, as they evolve as a business. So the way that this is broken down is that there are 7 core modules. You'll learn everything that you need to learn, from how to analyze the market to meeting your regulatory compliance points. You'll get the documents that I mentioned before that are going to help you just streamline operations, shrink the amount of time that's going to take you to try to think of these things on your own. You get checklists and assignments at the end of each lesson. And if you complete those assignments, you end up launching the business as we have designed. And you get that continuous support. So at this point, I'd like to open the floor for some questions. I know some of you may have them, and I want to make sure that you're able to ask. So please feel free to ask any question that you have. Okay, do you believe that the field has passed its peak value post-COVID? That's kind of hard to say. I don't believe that the field has reached its peak value. I think COVID was just an anomaly. Wages continue to increase. The demand continues to increase. If our population was shrinking in the United States, and if our healthcare spend was going in the opposite direction instead of growing at a rate of 6% a year, I would say, yeah, the peak has happened. What has happened was that COVID was a complete mismanaged bubble. And people who got into business during COVID is no different than people who got into real estate investing during the real estate boom. Even idiots were able to do well, right? They didn't have the infrastructure in place. They didn't have any recruitment tools. They were being given outrageous contracts to staff professionals. The money was moving, and you'll see it. Those companies are going to go out of business because they built businesses in a time where, as an idiot, you could have done well. But that was a short-lived bubble, and that's what happens in any bubble period. If you start during that bubble, when the bubble burst, you will not survive. That's why a lot of the agencies that started before the COVID bubble did really well, and they knew that it wouldn't last forever. So they didn't adjust their spending habits. Of course they increased their marketing spend, their advertisement spend to attract talent, but they knew that wouldn't last forever. And they had the skill set and the strategies that when the market does turn, that they know how to adjust. Okay, the next question is Melly. What is the approximate time frame from sign up to launch for the first option you discussed? And where does your company sets everything up? Okay, gotcha. I understand that. So the question is, what is the time frame? We like to get our clients launched in about 3 months' time. That's realistic in most states because the licensing is not as delayed as it is for home care, for example, as it is for medical staffing. So in most cases, 3 months, we could get you complete through the program, and sometimes 4 months. But there are a few things that highly depend on the founders. For example, we do your website setup, we do your promotional materials, we do your branding, we do your logo. We have people who will stay in that phase for months because they're slow to reply, they're indecisive, they changed the coloring. It can get drawn out. But if you follow our recommendations, then in 3 to 4 months, we have you up and running. How much do you charge for the setup option? So the setup option is charged, starts at 15,000 and can increase depending on the state. So if it's a high cost, high workload state for licensing, the price is slightly adjusted, but for the most part, it's $15,000. By comparison to our competitors, there's companies that are charging $100,000 for the same, which to me is a little ridiculous and insane. And then there's other providers that are charging approximately the same, but they do it as like a cohort where they'll group 10 people together and kind of give them courses. I think we offer the best value and best service at the price point that we have set ourselves up for. And that's coming from an operator that understands how much money should be allocated to starting one of these businesses, more so than it is about kind of gouging people to get in. And that's also broken out over installments. So there's an initial installment or an initial deposit of $9,000, and then 3 equal payments each month. So to get started is $9,000, then 3 monthly payments automatically billed at $2,000 per until the end point, which should be the close of month 3, and you should be fully launched and operational at that time. Marie, I joined late. I'm not sure if you went over what you went over. What services do you offer for someone who already established a business but has not launched yet? So that's something that we can discuss because we really don't know what stage you're in. Oftentimes, we get this call a lot or this question. I started my corporation, I started my LLC, and I have everything done. And since you're joining in late, there's a lot that goes into forming this business beyond creating the entity, getting your tax ID number, and being a registered business in your state, because you have to deal with all of your documentation, your policy and procedures, your applications, your compliance methodology, your contracts, all your branding material. So there's a lot more than forming the business. And I always kind of describe it as setting up the business is just the tip of the iceberg, because everything else is really what makes a difference. You know, it takes a day to get a business registered. Thank you. Also, what does a typical day-to-day operation look like once the paperwork is completed as the owner? Okay, that's a good question. So the day-to-day depends on the type of agency you're running, right? Because you have headhunter agencies that are recruiting and placing on a placement fee basis, meaning that I recruit a nurse, I place them at said hospital, and I get 15 to 20% of their annual salary as my recruitment or referral bonus or payout. And that's it. That's the end of the relationship. One-time payment, or sometimes it's a 2-time payment. The worker is placed. You're not responsible for billing. You're not responsible for maintaining payroll. So your job is to recruit and place. Some people like that format because there's less operational activities. In that scenario, your day-to-day is establishing new placement opportunities within that same facility that you already are working with, or establishing new placement opportunities with new providers and new facilities, and consistently recruiting, screening, and playing matchmaker. That's going to be in almost every day. The same is going to be the case in the other version of a medical staffing firm, where you are licensing out your staff to other facilities, meaning you recruit, you hire, and when you place your nurse, whether it's a traveler or a per diem nurse, you are billing per an hour or per a session or per visit for that employee. And you are paying them based upon your negotiated term. You are the employer of record, sending your licensed employee to another facility. So when that is your setup in your situation, you're going to be recruiting, you're going to be looking for new placement opportunities, you're going to be filling open shifts and positions, you're going to be filling open requests. You're also going to be managing daily attendance, time and attendance. You're going to be maintaining personnel record compliance. So if that nurse has been working with you for a year, you have to make sure that her nursing license is still active, make sure that her physical is up to date, that her annual TB test is current, all their insurances, CPR cards, etc. You have to maintain a continuous compliance program. What's the trade-off now? Well, I like the medical staffing model because you're able to build out your workforce and scale that workforce up so that when you're working with one nurse, maybe you're making $15 to $20 an hour, but when you're working with 20 nurses, you're now making $400 an hour for all the people that are placed. So you're able to grow out larger recurring revenue when you're going and functioning as the medical staffing firm that's licensing out your staff. The placement side of the business is for people who don't want to deal with that, and they'll rather the one and done, and they're going to build a mechanism that they can potentially scale and have more placements per month and make up for it that way without having to deal with the maintenance of the employees. It's kind of a personal preference. We've always been in the line of business of placing staff on a continuous basis with the option of placements. So there's buyouts on some of our staff, and there's providers that are sometimes moving away from agencies, right, to try to curb their cost. They may say, hey, we're trying to get away from agencies, we need more long-term staff, and then you can arrange for placement of some of your staff that are already working in the building and helping them meet their goals, and you can monetize that as well. Hi, I'm an RN with previous recruiting and HR background. Cool. Can an RN realistically be her own first employee, filling client needs? If so, how lucrative can this be in the short term starting out? So that's something that is quite interesting because we tend to like to work with healthcare professionals that are able to staff themselves out. The reason for that is because you're typically charging around a 50% markup above the cost to employ. So just for easy math, if the cost to employ a nurse was $100 an hour, you would be billing $150 an hour. So if you are the nurse who's staffing yourself, you, instead of earning what the market commands at $100 an hour, you'd be earning $150 an hour. And what that allows you to do is see the full cycle ahead of placing anybody else. You get a pay bump of around 50%, and you get to see what it's like to be screened, what sort of records the facility is asking for, how are you managing time and attendance, what is the reimbursement cycle from the time that you share an invoice to the time that you're paid by the facility. And once you have a good sense of how it works, oftentimes that gives you enough confidence to say, okay, now I can start to employ friends and family. And then once you're comfortable with managing friends and family, okay, I think I'm ready to step out and start recruiting and placing people I don't know at all because I have all the answers. And I find that healthcare professionals like that progressive approach because they're usually moving from the bedside, which has been maybe their only career, to the boardroom or to the administration side, and that's not their strong point. So they like to kind of approach it in the way that you have suggested. So that is totally possible and a viable strategy. The cost of $15,000 for you to set up, does that include the fees to the state, licensing, insurance, setup, etc.? yes and no. So depending on what is the registration fees, like for example, it can include the corporation fees, it can include some of the registration fees. My lead consultant handles that, but that is partially paid. Things like your insurance deposits and additional services outside of what we do is paid still by the the uh, the agency that's getting started. Now, if not, what would be a good cushioning amount above the setup cost? Thank you so much. So I would say like another $5,000 in soft cost that that's not paid to us would be a safe point to have. And then we also assist you with getting the kind of short-term funding that you may need to cover your payroll expenses. So that's usually the next question. It's like, well, how much money am I going to need to float payroll? Because you might be on a 30-day contract where you're getting paid 30 days after. We have preferred lenders that we could match you with that will allow you to kind of grow your business and utilize their line of credit to meet your obligations. So that's part of what's included. How much time slash hours should we expect to allocate weekly on working to set up the business during these 3 months? So I would say, I believe the team sets weekly meetings just to touch in and get confirmation. I think the more time that you put in, the faster things go. So I would say at minimum 2 to 3 hours a week. But I would would recommend that you spend a little more time than that. Not necessarily on what we're doing, but on what we recommend that you do while we're setting up your agency. So we always recommend that you go out there and start prospecting clients and start talking to other healthcare professionals that you plan on staffing. You should be spending as much time as possible on that, whatever free time that you have. The time that we schedule with you to get you started and to get your feedback and to kind of give you your next assignments, um, that's only going to be a few hours. So try to earmark as much time as possible to make the time to talk to the people that you're going to be doing business with. Starting with this business isn't just starting the business. Like you actually have to talk to the decision makers, talk to the people that you plan on working with. That's going to go so much further than anything else that we do. Those conversations that turn into contracts are on you, and we take away all of the administrative burden so you're not spending 15 hours a week doing paperwork feeling like you're making progress, because during that time no money's being made, right? But you feel like you're making headway because all of the optics are getting completed, and it makes you feel as if, yes, I'm moving forward, I'm getting this business under control. But the core of the business is placement opportunities and workers. We want you focusing on that as much as possible. So, Melly, what type of criteria do funding companies look at when deciding to support a new company's payroll? So it depends on which funding source, but generally they're looking at the credit worthiness of the facility that you're staffing, because what they're doing essentially is buying your receivables and expecting that facility to pay them. So they buy your receivables at a small discount, usually between 3 and 5%, and they then put themselves to receive payment. So let's just say you did $100,000 of billing for the week. They're going to advance you money on that 100,000, and they're going to wait to be paid by the facility. So they're doing the credit checks on the facility, which could save you from working with a facility that's notoriously known to stiff agencies. It happens, and they have the credit ratings for the facilities. So when that is a probability, they will not honor that particular facility, and you shouldn't either. The lenders So it depends on which lender, Andre, Andre Jr. It depends on the lender. So depending on what sort of terms you're looking for and what your status is, do you have collateral? Uh, really dictates, because there's a few different lenders that we can pair you up with. Uh, some lenders don't require any background check on your business or on your personal credit, because again, they're lending based on the facilities that you're contracting with. And then there's other lenders that are going to be lending based on you. So it depends on what you favor. Stacy, is there training? Yeah. So there is a sales training video where we actually go over cold calling. So you can see how that works. But the main thing that I would tell you, like, cold calling is a skill that you can develop over time, and because you've made a lot of calls. So I'll tell you a funny story. The first round of cold calls that I ever made, this was probably like in 2000, 2001. I had gone to college, and it was time for me to expand the business in the county of my college. I got the list of all the facilities in my county, and I started going through the list. It's 9 a.m., calling for the director of patient services, calling for the director of nursing, calling for the administrator. And I had my script set up so that I would call reception, and I would ask for the administrator or the nursing director, and I would kind of get past the receptionist to speak with whoever that person was. At this particular facility, there was no receptionist in that day, and the line was forwarded to the director of nursing. And since my script that I rehearsed for my cold call was dependent on first talking to the receptionist and then getting patched through, when the director of nursing said, "This is she," I froze, because my script wasn't adapted for that scenario. And that made me realize that even though you are prepared with scripts, those sort of things are going to happen in your cold calls, where you get someone who's highly engaged, who's chatty, who is a little cold, who may know you or may know somebody that you know. Things like that happen. And the conversation just goes completely differently than what you planned. So the best thing that you can do is just have a lot of calls, have a lot of meetings, and you'll eventually find your sweet spot for what is effective communication for you. The thing that I always recommend is cold calling sucks. It has very low conversion rates. And the thing that you need to do is move the conversation to the point of greatest intimacy, meaning you want to try to go from cold call to meeting face to face as soon as possible, because it's easier to hang up on people and dismiss an email or phone call than it is to kind of dismiss somebody face to face. It takes a cold person to kind of shoo you away when it's a face to face meeting. They tend to hear you out, give you a rebuttal, give you a reason, and then the relationship starts, because they may not be ready for you that day, but they now see you, they know who you are, they've started to develop a relationship with you. You're no longer just a voice on the phone. But we do cover cold calling and how to approach sales and how to approach landing contracts in this marketplace. Okay, this will be the last question. This may be a silly question, but are we expected to pay the pool of staff while we're waiting for the hospitals to pick them up from us? Just wanted to know. Okay, no, you don't have to pay your staff to be on your roster. So if you're recruiting and you're building a bank of eligible workers, they're not your employees until they're placed, right? They're your employees on your books, but you're not paying them for work that they haven't completed. You don't have to pay them to be on standby. a lot of nurses will be registered with a few different agencies because the rate of conversion is going to be different between the agencies, and they want to be working. So if they're, especially if they're per diems, they'll have 3 or 4 agencies that they're registered with. So there isn't a point where there's no shifts for them. When they're travelers or on longer term assignments, they also will kind of put the feelers out with different agencies because they also have to be selected. So they don't want to find themselves in a situation where they're out of work for a month and they don't want to be because they were counting on one agency and they were deep in the recruitment process. And then the facility decides that they were going to go with another candidate. So they tend to kind of put a couple of different lines out, and whichever one hits first or hits best is where they go. So you also need to build your pool and expect that people who have applied with you may say, that facility I don't want to work at, my availability has changed. So in that time, they're certainly not being paid. They're getting paid for the work that they perform. Awesome, awesome. Thank you for the webinar and all that you do. Oh, I thank you for joining. It's a whole lot better talking to people than talking to the camera with nobody on the other side. So I certainly appreciate you guys participating and asking all your questions. Just to close out, let's talk a little bit about what are your next steps. So after you've gotten your business set up, it's about securing your first client. Chances are your first client is going to come from a friendly. And what I mean by that is that people that you've worked with in the past, former classmates, friends and family, people in your circle, because you're not coming in cold. They know you already. So they're more willing to hear you out and give you a chance. If you don't have an established network, then you're going to have to build one through cold calling, cold emails. Like I said, that's a high volume activity, low outcomes. And your entire intention is to move that cold interaction to a warmer interaction. Zoom calls, in-person meetings, lunch and learns, where you're presenting and, paying for their attention through food. It works, right? So you have to try to move things to that point of intimacy where they get to know you, they get to identify with you. They see a little bit of themselves in you. They like your personality. You seem trustworthy. You seem knowledgeable. You answer my questions on the spot. The other agencies don't do this, right? It starts to set you apart from some of the competitors as well. So you have to build. Well, sorry about that. I just stepped on my remote. Give me 1 second here to get back to where I need to be here. Okay, there we go. Sorry. So yeah, so you want to move to that point of greatest intimacy so that they get to learn a little bit about you, your agency, and start to differentiate yourself from your competitors. You're going to have to start your digital outreach, right? So thinking about, this isn't about advertising, especially for getting your first client, because they're not doing a Google search to find an agency, right? Very rare. They got to be pretty desperate to start doing that. So you have to start to do your LinkedIn outreach, using Apollo, the AI tool, to kind of scrape and locate decision makers. And you're gonna have to just start reaching out, figuring out exactly who you're going to go after, what are their pain points, really understanding the customer. And then when you're looking at doing whatever your local outreach is, popping in, walking into facilities, sometimes they just don't answer or return calls. So you might have to pop up to get their attention. They don't really like that, but at least you get an answer, at least you get seen. It allows you to potentially move the conversation further. Now, this was a question that we had a little bit earlier, kind of what does the operation and day-to-day look like? So it's going to be an ongoing game of recruiting new talent because you're going to have people who cycle out. They work a 13-week assignment with you. Winter is coming. They don't do winter. They're out of New York, out of the Northeast. They're down into the Southwest, right? For the winter months. You're going to have people who churn out like that. You're going to constantly be recruiting people who take a position, work one shift, flake out. This happens. So you want to have ongoing effective recruitment where you are accurately sourcing talent, where you have a clear kind of screening process so you can weed out those flakes. It helps you establish a strong brand, and it helps you to establish a strong brand as well, because they'll see your name popping up, more job postings. They get, people have to see that you exist sometimes to trust what you're doing. And you're going to have to learn to embrace technology to help you with that. Okay. Help you with posting your ads, help you with optimizing your ads, tracking the effectiveness and the recruitment funnel itself. So these are the things that you're going to constantly be tuning day to day. Okay. You also are going to be spending time really getting feedback. The thing that I would say kills it for most healthcare professionals is not pay, it's the environment that they're in. Nobody wants to be in a facility where they feel abused, neglected, at risk of getting injured, at risk of getting some sort of action against their license. They don't want to be in uncomfortable situations. So it's important for you to get feedback from the employees, the people that you're staffing, to know a little bit more about the facilities, what's good, what's bad, and trying to adjust for that so that you don't lose good people. What tends to happen is you think, okay, I've placed somebody, success. No. Place them, follow up with them, make sure the placement's the right fit, because you can lose somebody that thinks that you just threw them into hot water and you don't care. Okay, this happens all the time. So you have to understand what matters to your employees. Be open to talk about compensation and benefits and what can be done. Encourage them to recruit others, right? For bonuses, for making introductions to facility managers at other facilities that they work at. Really try to develop a culture within your workforce of people who are working with you to help you grow within the organization. Sometimes people like having that ability to promote and get a little more value out of the job just because they have a voice, because they have a presence there. You'll find that some employees, that's enough for them to feel satisfied in their job, is that they're actually helping, right? And you have others that like the money, and you have others that like the feedback. So really take your time to talk to your staff, talk to your vendors, understand the pros and cons that as they see it, and progressively adjust your business so that you are optimizing for success. And just before we close out, I guess I'll open the floor for just a few more questions. And if there are no further questions, we can close out. Just to give you an idea, I know we asked about pricing for the full service setup. Everybody's budget is different, and that's why we offer two different services. So the full service setup, where we take care of all the details of the business, the setting up of the corporation, the licensing, the branding, the policy and procedures, the securing and negotiation of your insurance requirements, so general liability, workers' comp, etc. We work on all those things. That service starts at $15,000, and in most states it is $15,000. Paid out $9,000 in the first installment, and then $2,000 in each additional installment. Also, we'll send you more details on this and an opportunity to talk with our consulting team so that you can have your questions answered privately. But that's the first option. The second option is a self-directed route. That's for people who prefer to do everything themselves, or that's within their budget. That self-directed option is $2,000 as a single payment, and you'll get the same sort of structured online program. Even the full service clients get the same program so that they could watch along and understand what's happening in their business and learn. There's lessons to be learned, not just how to set up, but scenario based learning and kind of my experiences. So you get that. You get a policy and procedures template. You get a sample contract. You get calculation spreadsheets that helps you estimate how much you should be billing, how much you should be paying, what would be your margin given either your bill rate or your pay rates or both within a certain market. So we give you all those things plus the monthly group mentoring, which both customer groups are entitled to, and that is a $2,000 one-time payment. So again, it really depends on what sort of person you are and what your budget is. I think there are positives about both programs. We wouldn't present something or offer something that we don't believe will work for people. Ultimately, it's up to the personality and what style they prefer. I prefer full service setups because I don't like to do tedious work. That's me. So whenever I'm faced with the option of assigning something to someone else, I will. Just this morning, I had a call with a grant writing company that they apply for federal grants, and their fee is $25,000. And I said, well, would I be willing to pay that or do this grant writing myself? I don't want to deal with that. I don't have the time to deal with it. I actually feel my time might be worth more than to the 25,000. My personality, hey, just pay them. And that's like a different model. But that's what I would prefer. If I didn't have the capacity to pay and I wanted to do things myself because I really want to learn the details, then I would go the other route, right? And that would be time permitting and also depending on how much I want to invest. So that's how the two are structured, and it gives you a sense of pricing and what you could expect. Any other questions before we close out? Okay, I guess there are no further questions. Awesome. So as a reminder, we're going to follow up with everybody who registered so that whenever we release the replay, you go back, you can rewatch this. We're also going to send you a little more information on each of the programs that we offer, who's it for, how's it structured, what you expect in timeline. And there's other information that we'll send you. Just be on the lookout for all that we do. We have our channel at Passive Workforce, both on Instagram, TikTok, and YouTube. We're constantly putting out tons of information on how to start, grow, and eventually exit one of these companies. We also are covering home care. So for those of you who are interested in that line of business, which is very similar to this, you can definitely learn more about what we're doing and how we're helping those sort of companies come to market as well. A question came in. How soon would you be live if everything is done? Depending on the state that you're in, I would say it's safe that you'll be live in 3 to 4 months if we're handling your account. We find that if you're engaged, Rhode Island, that I don't know off the top of my head, but I would imagine it's about 3 to 4 months. So it'll not a problem. Florida, about the same. Florida's pretty quick. So yeah, for the most part, it's 3 to 4 months. There's some of the states that are just slow to answer the licensing applications. They'll cash your check, but it'll be quiet for a while. Like North Carolina can be slow at times. I don't know if there was just a staffing issue there, but for a while they were really slow. Illinois is a lengthy, annoying process. So the states they're different. They're managed differently. I don't know how large their teams are, but some are a little bit faster than others. New York, for example, They started to mandate licenses without having a licensing process. So they created an application, of course, a fee associated with that, and they don't have any method of tracking or confirming where you are in the process. But if you've paid your fee and you followed the guidelines, then you're able to operate, because all prior to them requiring the license, there was no license in the state. So all of the companies that were operational before and put in for their license are also grandfathered to operate. And any new operator who put in for the license and their check is cashed, they are also able to operate. But they don't have any real roadmap for how they're going to manage these agencies. It's a complete circus, and this is just how the government operates, unfortunately. Okay, guys, thank you very much for attending. Like I said, we're going to be sending you out some information on how each program is structured. We'll also be sending you some follow-up information as to where you could rewatch this video. If you have people that you're going to be launching with, I highly recommend that they also check out the video so you guys can kind of get a sense of, is this the direction that you want to go in? And we look to onboard continuously. Now, we do have a capacity of how many providers we could launch in a given month. So we try to do the best that we can. Some months we're delayed, some months we have some openings. So if you are interested, just let us know and what your timeline is, because we can plan and organize for where you could fit in. We don't do group sessions like with our full service clients. Everything is individualized. So we don't just lump together 10 or 15 people and put them into the same program at the same time. We give everybody the individual attention that they deserve. So we have, a capacity that we cannot go over. So just let us know if that's what you want, and then we'll be able to kind of plan and work out the timing of things. Okay. Hopefully all goes well, and we'll see you getting your agency started in the next few weeks. Take care, guys.